Welcome to the Forgotten Trimester, a channel dedicated to all things postpartum. Today we're going to talk about vaginal lacerations and how to manage them. So you're going to learn all about what a vaginal laceration is during the delivery process. You're going to learn how to manage a vaginal laceration at home, when you need to call the doctor, and what the recovery time is. I'm Dr. Megan Gray. I'm a board-certified OBGYN and mother of 2 littles. Let's start by defining vaginal lacerations. So what exactly is a vaginal laceration? Another term for it is vaginal tear. So it's something that occurs during the delivery process as the head and the remainder of the body is delivered through the vaginal tissue. Sometimes the vaginal tissue doesn't stretch quite enough, so it will tear. There are different types of tears, and when your physician or your midwife discusses with you what kind of tears you have, they're going to use the term 1st degree, 2nd degree, 3rd degree, or 4th degree. A 1st degree vaginal laceration is the most minimal laceration you can have. It is very small, heals very well, all the way to 4th degree laceration, which is the worst laceration you can have. A little more complicated, tends to not heal quite as well in a lot of people, but I'd like to talk about each type of vaginal laceration in a separate episode so we can give each laceration a good amount of time. So on this episode, we're going to focus on just the 1st and 2nd degree vaginal lacerations. We'll do separate episodes on 3rd degree vaginal laceration and a separate episode on 4th degree laceration. So because I'm not an artist and I can't show you a vaginal tear in a stick figure because that's about all I can do when I draw, I am going to use a book called The Atlas of Human Anatomy. It's by Netter, who is like the guru of anatomy. This is the book that a lot of physicians use as their training and learning about anatomy. So I'm going to use this as a reference and to show you a picture so you can kind of get an idea of exactly what I'm talking about visually instead of trying to conceptualize it in your head. So once again, we are talking about a 1st degree vaginal laceration or vaginal tear and a 2nd degree vaginal laceration or vaginal tear. So quick lesson on the anatomy. This would be your pelvis as you were looking up as if you were sitting in the stirrups and looking up into the vagina. So this is the vagina here. This is the vaginal opening right here. This is the urethra where the urine comes out, and this is the clitoris, and this right here is the anus. So when we talk about a vaginal laceration, a 1st degree or 2nd degree vaginal laceration, we are talking about a tear right in this area here. And it's usually going to be, the 1st degree is just going to be this minor tissue right inside the mucosa, which the mucosa is similar to the inside of your mouth. It's a very small tear. It's very easily repaired with a couple stitches. Then a 2nd degree laceration goes a little bit deeper into the tissue, so you'll tear right into this area here. So that's going to require some more stitches, but once again heals very well. Usually most people have no problems with the healing process from a 1st degree or a 2nd degree vaginal laceration. It never involves the anus. It never involves the anal sphincter. So the major damage that some women talk about does not occur with a 1st or 2nd degree laceration. It is primarily centered right in the vaginal tissue itself, maybe a little bit deeper, but not so deep that it's affecting the deep muscles of the anal sphincter. So after you've delivered, your doctor will assess the vaginal tissue and then notify you of what kind of tears you have. Then the doctor or the midwife will repair those lacerations or tears with stitches. A common question I get asked when I'm repairing vaginal tissue is, well, how many stitches did you use? And we don't do it like that. We don't do little individual stitches. It's a running stitch, kind of like you're sewing, you're hemming pants or a shirt sleeve. So it's a one long stitch. So we don't count stitch by stitch by stitch. But once again, usually this first and second degree lacerations aren't large. They usually are small. It usually does not take a long time to repair them in the delivery room, and usually very well tolerated and heal very well. What to expect after the repair of a vaginal laceration that is a first or second degree vaginal laceration is some discomfort, mainly from a large head just coming through the hole the size of a tennis ball, but you also are going to feel the discomfort of the tear, especially with urination the first couple times. When that urine hits the tissue, it may burn. So there's some tricks of the trade to help reduce that burning and to help with that. You also are going to just feel sore. You may feel a lot of pressure down there, like a head still sitting down there. That's very normal for any kind of vaginal delivery, whether you had a tear or not. You may have some dull aching or throbbing pain from the tear itself. Usually that discomfort will go away within about 48 to 72 hours. Deeper second degree tears may cause a little bit more pain for a longer period of time. Maybe you may even feel discomfort for 5 to 7 days, maybe even 14 days after delivery, but each day the discomfort should get better and better, and it should not be exquisite. It should not be to the point where you can't sit down because it's so painful. So how do you care for this vaginal laceration? It's very easy. It's not complicated. You don't need soap. All you need is water. If you deliver at a hospital, you should receive, most hospitals will give you one of these after delivery on the postpartum floor. It's a perineal bottle. It is basically just an empty shampoo bottle that's never been used for shampoo. All you have to do is fill this with some lukewarm water and then spray. So no soap, just water. Spray the vaginal tissue. You can spray whenever you want. I definitely recommend spraying after urination, after bowel movements, in the shower. But if you just want to spray, spray anytime you want to. Then pat dry with a towel or toilet paper, although this will get you pretty wet, so toilet paper tends to fall apart. I would say clean, dry towel. Or you can take the hair dryer on the cold setting and use it to gently dry the area. It does not have to be bone dry though. So sometimes that can be very irritating if the tissue gets too dry. So make sure it's on the cold setting and just gently dry it. Don't get it so dry that it's uncomfortable for you. Another option you can consider is a sitz bath. That is a basin that you can buy at any kind of drugstore, CVS, Walgreens, or Walmart. It fits, usually they fit over the toilet. You fill it up with a couple inches of lukewarm water and you sit your bottom down in it just for about 5-10 minutes. It helps to alleviate discomfort. It also helps to clean the area. Then you stand up, pat dry with a clean dry towel, or take the hair dryer in the cool setting and dry. Then just make sure that in between uses of the sitz bath that you're cleaning out the sitz bath really well with a mild detergent. Things to avoid after a vaginal laceration are nothing in the vagina. So absolutely nothing. And patients always want to know, well, what does that mean? That means everything. So no tampons, no douches, no fingers, no tongues, no penises, no toys, nothing in the vagina for at least 6 weeks. We also recommend avoiding sitting in a bathtub, a swimming pool, lake water, beach water for at least 6 weeks after delivery to allow those stitches to completely heal and dissolve so that you're not getting bacteria up near that tissue as it's trying to heal and increase our risk for infection. When should you call your physician? If you start having severe pain, so pain to the point where you can't sit down, or the pain starts getting worse instead of better, that should be evaluated. That's when you need to call your physician. if you're noticing a drainage or discharge from the vagina. Green, yellow, foul smelling, that also needs to be evaluated, so you need to call your physician. In general, the recovery time for a 1st degree or a 2nd degree vaginal laceration or tear is about 6 to 8 weeks. It takes about 6 to 8 weeks for those stitches that your physician or your midwife used to close the tissue to dissolve. Those sutures will dissolve on their own. It just takes approximately 6 to 8 weeks for them to fully dissolve and for that tissue to fully heal. That's why we always recommend absolutely nothing in the vagina for 6 to 8 weeks to allow that tissue to fully heal before it gets stretched back out, or to prevent disruption of the stitches. So that covers it for 1st and 2nd degree vaginal lacerations or vaginal tears. I hope that this sheds some light on those 2 issues that are associated with vaginal deliveries. And I hope it's a little bit of reassurance that they do heal very well. You really shouldn't be bothered by them at all. But certainly if you are having any issues that you notice or something just doesn't feel right down there, I would encourage you to seek the help of your physician or your midwife. Thanks so much for your time today. I look forward to seeing you real soon on a next episode of Forgotten Trimester. Stay tuned for the episodes in regards to 3rd and 4th degree vaginal lacerations. Bye-bye.